understanding fatigue. Fatigue is experienced by different people differently. So how you experience fatigue might be quite different from the person who's sitting in the next seat or in the next row. Some patients describe fatigue in terms of sleepiness, others in terms of weakness. There are also patients who describe exercise intolerance being the main issue, or also just a sense of exhaustion. So in terms of scientifically, fatigue is described as a time-related phenomenon of decline in the maximal force generation capacity, say, of a particular muscle. So we'll now look further into this. Fatigue can be defined as physiological fatigue. And interestingly, there's a peripheral component in terms of how the muscle and the nerve works, or the neuromuscular junction works. But there's also a central component that we'll talk about very shortly. Physiological fatigue can include a sense of tiredness without sleepiness, but also a sleepiness in addition. It causes exercise intolerance. Then there's the next aspect. It's called psychological fatigue, but in other articles, it's described as perceived fatigue. It has to do more generally with a person's well-being, their ability to concentrate, and it's dictated by also the general amount of physical activity that they do, and it also dictates how the person's able to function socially. So this is a pictorial kind of description of how fatigue can be described as a loss of voluntary force-producing capacity during exercise. So you can see that the amount of force over time, I think it's this one, the force over time, there's a decline. But as there's a decline in the maximal force that this person, for example, is able to exert, that person may not necessarily feel the fatigue. Now, there's also the concept of central fatigue. Central fatigue is when the peripheral things such as muscle, neuromuscular junctions, and nerves are working to their capacity. There's also an extra element of how centrally the person is able to drive what the peripheries actually do. And in a particular kind of investigation in the investigators shown by stimulating, say, a particular muscle with supramaximal kind of stimulation and getting the person to exert the maximal amount of voluntary kind of strength in a particular muscle. So if you think about a person already exerting to the maximum, is able to use all the peripheral forces maximally, and then you try to stimulate it with a stimulus, you shouldn't be able to produce more force. Whereas if a person tries their hardest, but for some reason or other cannot exert everything that the peripheries can afford them, then there would be an element of central activation failure. So what this study found was that in healthy population, about 12% of them, they can have a central activation problem. But interestingly, in people with neuromuscular conditions, the central activation failure is actually higher. So this study didn't specifically look at patients with mitochondrial disease, but these patients have muscle weakness, such as those with facial scapulohumeral muscular dystrophy and myotonic dystrophy. And they also have a neuropathy. So those are the patients with Charcot-Marie tooth disease. So it's interesting that in the population that's affected by the chronic disease, they can also have a central activation failure in addition. And the investigator conjectures perhaps there's also an element of the person's concentration being affected, motivation being affected, or effort being affected. Now, we talk about how we can measure fatigue. So in clinical trials or in some clinics where we want to monitor how patients are going, we often use patient-reported outcome measures. And one of those are questionnaires such as fatigue severity scale. It can track a person over time. So up the top, it talks about whether there's lowered motivation because of the fatigue, whether exercise brings on fatigue, a person's physical functioning, and it also talks about how it translates into it affecting the person's ability to do their duties and responsibilities, and how it affects a person in terms of whether it interferes with the person's work, family, and social life. Down the bottom is just a scale, literally a straight line. So you can mark on there if you feel perfectly normal, closer to 10, or if you feel not quite right or severely affected, then on the 0 side. So that's a more descriptive way of measuring fatigue. Then there's a more objective way of measuring fatigue. This is what scientists in the past has used. And you can see on that person, they've got a very old dynamometer. Nowadays, the dynamometer might be much more compact. And what that investigator is trying to do is to get the person to wing their shoulder by exerting that, we call it abduction of the shoulder. And then over time, they ask them to repeat it 10 times. So really strong, really strong. Really hard in the opposite way to check the force that can be exerted onto the dynamometer. And they factor in the fatigability as a percentage of decline in the shoulder winging or abduction force over 10 successive maximum voluntary contraction. And not surprisingly, they do find that there is excess fatigability that's independent of muscle strength in patients suffering from myasthenia, which is a condition that affects how the nerve communicates with the muscle, in patients with mitochondrial disease, and also in patients with motor neuron disease that has to do with the motor neuron failure. So in terms of graphically, this is what it looks like for normal people. The females up the top and the males down the bottom. So you can see the female or the male is exerting push, 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 push. And then you can see the female tends to exert better on the second time, whereas the male seems to do best when they initially do it, and then it declines over 5 succession contraction. So in normal people, that fatigue doesn't really kind of, get significantly worse. Whereas this example is an example of a person with a neuromuscular junction problem called myasthenia. For this particular condition, there's an option of treatment with an immune therapy called plasma exchange. And you can see for this 29-year-old woman that she scored herself better in terms of how she feels over time, and correlating with that, the fatigue index is reduced. Whereas these actually didn't correlate with the maximal strength that the shoulder abduction was demonstrating. And for this particular person, the time they took to walk a certain distance didn't actually change very much. And it's just to say that fatigue is a separate issue sometimes compared to, the other things that you can measure. And for an individual, the ability to do certain things can be very specific, and the fatigue over time can also be specific. Now, we quickly talk about the prevalence. We all know here that mitochondrial disease affect people by causing fatigue. But interestingly, in an old UK study, they ranked that fatigue can be the third on the list of the most reported symptoms in patients presenting to their GP. So it calls for all the other normal people. They think they're normal, they also have fatigue. In other neuromuscular diseases, more than 60% of all patients in a particular study also suggested that they had severe fatigue. And this is despite their peripheral symptoms not being severe. So they might have muscle that can exert the strength, but they're still describing a lot of fatigue. In one of the US studies on mitochondrial patients, about 48 of them, they described that about 71% to 100% of them actually experienced fatigue. Whereas this older study from the UK that studied about 132 responders, they found that 62% of them reported excessive symptomatic fatigue and 32% reported severe and functionally limiting fatigue symptoms. So yes, fatigue is very prevalent. But the toll of fatigue needs to be recognized. It's not just the tiredness. This is how an individual in that particular paper described how they personally experienced it. That personally, I see fatigue as a greater problem than my quantifiable somatic symptoms and impairments. The fatigue makes me miss out on numerous things, whereas I could learn to live with my somatic disabilities. So I guess that person might be describing, say, if you have difficulty getting from a chair, you know that today and tomorrow you'll have the same difficulty. So you work around it by a higher chair, etc. Whereas with fatigue, you can't really predict it. The morning feels different from the afternoon, different from the evening. One day just feels different from the next. And you can't plan ahead. That's been the major problem. So as we can see, fatigue in general and fatigue in mitochondrial disease is a complex affair. Interestingly, obviously, it's not associated with just one factor. What this study tried to do is to lower a person's lactic acidosis as they exercise. And what this Danish group has found is that by lowering the lactic acidosis in a person with mitochondrial disease that predisposes them to have high lactic acid, it didn't help with their ability to use oxygen as they exercise. So it means that there are other factors that are involved. Now, as Professor Koenig has mentioned, mitochondrial disease has a problem with energy production. And we generally know the idea that when there's a problem with the mitochondria, there is a reduction in the aerobic energy production, and instead the body tries to use an alternative pathway. We say the anaerobic pathway, and then it increased the demons of the free radicals that we saw the diagram of a little bit better this morning, and they're toxic to the cells. Down below in the diagram, it's one of your favorite writers, Tarnopolsky, some of you, which talks about exercising in patients with mitochondrial disease. What this diagram demonstrates is that on the left, patients with mitochondrial disease are not able to use oxygen as well to produce the energy that they require compared to a normal person. Yet, a person with a mitochondrial disease might be actually working very hard with increased cardiac output to try to compensate that. So as a result, you can see why a patient with mitochondrial disease does fatigue. Now we come to the Italian cohort just because they've described it recently. So out of 117 patients, you can see that fatigue is a common symptom. But what you can see also is that patients with different mitochondrial conditions can experience different degree of fatigue. Over on the left, you can see patients with pure progressive external ophthalmoplegia, that is just eyeballs that don't move without so much of the weakness associated with the mitochondrial myopathy. They may not have as much of the fatigue, whereas patients who have a combination of CPO together with the mitochondrial myopathy, particularly some of those who are weak or with certain mutations, they're more affected by fatigue. The group has found that over a 12-month period, the fatigue seems to be stable. And it also that the amount of fatigue that's measured on a fatigue scale actually correlates with their 6-minute walk test, so their physical functioning as well.